missing teeth. Missing teeth is many people have it, and I'm not talking about missing teeth in front, because if a person has missing teeth in front, he usually fixes them fast simply because it's ugly. However, in the back, not so much. And here's what's happening, what I see. Patients like me, we have a missing tooth or two in the back, and the first week or so, it's a little uncomfortable, and we do notice we chew a little different, and we play around with the tongue. But after that, it's a rather normal thing, and we don't feel like spending hundreds, sometimes thousands of dollars to fix it, because it doesn't look like it's bad. And yet you dentists keep telling us it is bad. We must fix it. Can you shed some light on that and tell us, does really every missing tooth have to be replaced, and why? Why do we patients years later kind of go, well, I don't know, I mean, I'm just as fine as before, and and why do I have to fix it? Please tell us about it.
Back teeth are very important for chewing. We bite with the front teeth, but we chew with the back teeth. So not having back teeth, we're putting more force to the front, which were not created to actually chew the food. Then you put more force on it, you intend to break the front teeth more. Also, you create a problem with TMJ. TMJ is temporomandibular joint. It's like a knee joint. If you don't properly exercise it, you get a pain. You release all the fluid from there, you start to hear the clicking noise, you hear, every time you yawn, you hear a click, or it hurts, and it starts to create even more problems.
Is that, let me ask you something. So,
sure.
I come from a mechanical machinery viewpoint, so I do definitely know that, let's say you have a door or cogwheels, if one of them is out of alignment, out wacko, it creates havoc. Eventually the machine will come to a grinding halt. Is that basically what you're saying? So you start using the hinges uneven, and because of it, they pull funny nerves. And is it? I've heard that I didn't at this point realize that, but I heard about when you have TMJ and when your hinges are out of alignment, you can get migraines, neck pain and shoulder pain, maybe even back pain, but definitely up there. And I know people with migraine, they don't like it. It handicaps you in life. It's a life, you come home, you had migraine all day long, the kids start jumping on you, and you go, not today, go and be quiet. I mean, this is more devastating, frankly, than the headache in itself, because you're ruining a family life.
Absolutely.
So
absolutely.
Are you saying missing tooth could potentially create that?
Absolutely. Because it changes the occlusion, the way people bite. So it's not, as you mentioned, it's not an even bite anymore. So it does create a problem. It does not happen overnight, but with, years of not treating or replacing missing teeth, that's what happens. And the longer you have postponed the problem, the bigger the problem you create for yourself. That's much harder to improve, much harder to heal, treat. So the reason we as dentists try to tell you it is very necessary to replace a missing tooth is for you to prevent bigger problem in the future.
So basically what you're saying is, you said it doesn't come overnight, and that's exactly the reason we patients go, hey, what's the big deal? A little bit like eating very, very badly, like super high cholesterol food, not exercising, and whatever it might be. And the arteries don't clog up overnight, obviously, They clog up over whatever, let's say 20, 30 years. Well, when they are, however, clogged up, it is extremely difficult, if not impossible, to refix it. And that's about what you compared. However, since I said impossible to fix, let's say, the clogged up arteries to a high degree, TMJ is, however, fixable, because I have heard that people who have had headaches, migraine headaches for a long time, didn't know why, went to chiropractors and it worked, but it can't keep coming back, went to nerve doctors, to, all kinds of things, took millions of aspirins and more strong stuff. And then the next thing you know is a dentist with not necessarily one, but a couple, 2-3 visits, fixed the whole thing. So obviously it is fixable, but why get there? Why have...
exactly.
Yeah.
Why do you have to go through all that trouble, going through so many specialists to find out what is the cause of your headache or earache or shoulder ache when...
Well, the fact is, it's funny that you say that, but all the people I know, and it's not that I know so many in that particular area, it was never the specialist who diagnosed that they had the headache, the migraine from the DMJ. It was always the dentist. The medical people, they immediately go, not that we don't need them, but when it comes to certain things like that, they immediately go into, well, there must be a neurology problem, there must be this, there must be that, there must be a chemical imbalance, as we're not born with a chemical imbalance. And it is always the dentist who does it. So based on that, would it be wise for a person, whether he has missing teeth or not, because there are other reasons why a person could get an uneven jaw and whatever. If a person has migraine, has tried a thing or two, didn't yet get rid of it, got kind of the typical, well, that's what you have, and take those medicines, would it be wise for him to go to a good dentist and say, I have migraines, see whether there's anything to do with teeth? Would that be a good move for a patient?
Absolutely, absolutely. It's a necessary thing. And actually, at my appointments, whenever I see, especially first initial exam, I always check the TMJ. I always check head and neck to make sure there are, no problems. And if there is, I ask actually, do you get headaches, especially when you wake up in the morning or later in the afternoon? And the patient, how did you know that? So because I do know what causes it. I check that there are missing teeth. I see it's clicking in TMJ. So I know that there is a cause to that problem.
Got it. They probably look at you like you're like some type of cobra trying to bite them about, headaches. Why are you asking me about headaches? What does that have to do with my teeth? Just put my filling in and leave me alone.
Yeah.
Okay, good. Well, this is wonderful. Yeah, with no doubt, and as you mentioned in some other talks with me, it is amazing how many areas of the body the teeth specifically influence. Dr. Khaimov, thank you very much. Very enlightening what you just taught us.
Yeah.